Now, when we think about digital health and human rights, and we think about the rights of folks who are 50 plus, and certainly needing the that digital health technologies to help enable their not only their process of getting older, but also the process of doing so in a way that's going to protect their human rights. There's no better brand, there's no better organization in the world to protect people over the age of 50 than AARP. I'm also a proud member and just have had a great relationship with AARP over the last decade plus now, given their activity and how much they do in innovation and in digital health. And so today we're really happy to join us Sheila Collins, who's one of the leaders with the AARP Innovation Labs. So again, another incredible organization with AARP Innovation Labs. Sheila, thank you for joining us today, and looking forward to hearing your interview with Tembo Health.
Glad to be here. Thank you so much. Well, hello, everyone. I am Sheila Collins, Senior Advisor at AARP Innovation Labs. At AARP Innovation Labs, our focus is on empowering people to choose how they live as we age. And with that, we are always on the hunt for the most disruptive startups who are doing work in the health tech space. And today I'm excited to present to you Tembo Health and Dr. Anurag Gupta, who will be talking to us about what Tembo Health is and how he got started on his journey. So hello, Dr. Anurag Gupta, how are you?
Hi, good afternoon. It's a pleasure to be here. Thanks, Sheila and HitLab.
Good to see you again. We were just at a conference called Health, and so had an opportunity to spend half a week with you. So for the audience, if you could talk to us about what Tembo Health is and how you got started.
Sure. So Tembo Health is a digital health platform for senior healthcare. We're currently partnering with senior communities like nursing homes, CCRCs, memory care, assisted living, independent living, and so forth, to bring the right access, the right resources for healthcare. And so we've stood up a 24/7 emergency medicine platform. We have a telepsychiatry behavioral health platform. We're launching a new monitoring chronic care program as well. And the ultimate goal is to keep seniors healthy, happy, and at home. And so through our platform, we've reduced emergency room transfer rates by 75 to 85% for our members. And so it's really amazing, just making sure that they are where they belong, which for us is home.
And Anurag, what was the inspiration behind Tembo Health?
So my personal inspiration was my own grandfather. It was about 6 years ago. He was 89, 90 years old. I grew up in rural Michigan. And it was, his series of complications after one bad fall. He was just needing much more attention and supervision. And with my parents working, it was very difficult for them to manage him at home. And so we moved him into a community. And what we found was a really amazing group of nurses and caregivers and aides that were really attentive. And we were so happy. But anytime any clinical event occurred, there was no doctor to be found. And so the reflex is call 911, get the ambulance, you send them to the emergency department. And once you show up to the emergency room and you're 90 years old and you're on a dozen medications, the default is to admit you to the hospital. And so it was just very frustrating. Personally for me, I am a board certified emergency medicine physician. I was in New York when all of this was going down, and it was heartbreaking to kind of have this experience month after month. And given my other previous experiences, including setting up tele-ICU programs and so forth for health systems, I felt like there had to be a better solution. And so that's what drove me to launch Tembo.
Well, I'm glad you created this better solution. What have you seen change or be augmented during the pandemic as it relates to telemedicine?
Yes, I would say that so we launched in 2018, so this pre-pandemic. But with the pandemic, what we've really seen, I think, across the country is just that cultural change and shift towards the acceptance that, yes, I can receive high quality care via telemedicine. I know that there's a lot of variability out there. I think especially when you have such a dramatic need like the pandemic, there's so much variability in terms of what people have experienced in terms of telemedicine. At Tembo, we take a very holistic approach. For us, communication, collaboration, coordination are all very critical. And so even pre-pandemic, we set up a system and a workflow and technology integrations to ensure that our clinicians, as they're treating seniors in these communities, have access to the right information at the right place in a structured format, which allows them to ultimately work smarter and faster, which really ultimately makes sure that the senior has the right diagnosis, the best treatment plan. And so we think that that's still very critical, and we're hopeful that a lot of other telemedicine projects that have been set up through the pandemic will continue to evolve, keeping in mind that this focus on information and data to drive the right care.
Got it. Thank you. That was really helpful. One of the things that we know is that our population is aging, and it's aging fast. To the tune of 10,000 people a day are turning 65. I wanted to get your thoughts on kind of what the implications of this are on the healthcare system.
Well, there's two issues. So one is, yes, the population is aging, and so we're experiencing now and over the next 10 years, more and more of our fellow citizens are going to be older with more chronic conditions, more complex needs. Already today, there is a lack of physicians in the U.S. today to treat our current population. And I'm sure as many of you on this call may have noticed, that if you're trying to seek new care from a new clinician, depending on where you are in the country and what kind of doctor you're trying to see, you're experiencing wait times. I know in New York City, if you want to see a new psychiatrist, you're looking at 6 to 9 months. Cardiology is 4 to 6 months to get a new patient visit. And I know that even in rural Michigan, where my family lives, it's similar wait times. And so the issue with this aging population is that actually about 40% of the current physician workforce is also going to be retiring in the next 10 years. So we're actually going to be losing 40% of the clinical workforce in that time period as the population continues to age and grow. So it's actually going to be an incredible crisis in terms of access to healthcare resources. And so I think things like telemedicine and more automated solutions can help drive more efficiency in the system at large to help make sure that we can keep the population healthy and well.
Wow, that's scary to think about, just the fact that, as you mentioned, the aging population is growing, and then the care to support that is decreasing. In terms of that, the topic for today is human rights. How do you see your platform as a solution within human rights?
Yeah, so for us, it's really the right to access healthcare. And as I experienced for my own grandfather, and now for the thousands of patients that we're responsible for across the U.S., what we see is that there's just a lack of access, a lack of just providing the right care to these seniors. For a variety of reasons and factors, seniors just are not afforded the opportunity to receive high quality care. And I think, if you look at Medicare reports and NIH reports and so forth, and everyone always says, seniors are the most expensive healthcare utilizers. They're in the ER all the time, they're in the hospital all the time. But that doesn't have to be the case. I mean, if they had the right access to proactive care, they wouldn't need to go to the emergency room. I mean, there was absolutely no reason for my grandfather in 6 months that he was in that senior setting. He went to the ER 6 times and was admitted to the hospital 6 times. If I had lived in the same town, he definitely wouldn't have gone to the ER even once. If we had access to the right care, as an example. And so for us, it's really about just democratizing access to the right resources to the senior population, ultimately keeping them healthy and at home. And again, right now we are focusing on senior communities because for Tembo, it allows us to leverage that infrastructure that they already have, and it's allowing us to scale fairly quickly. But our goal is, as we continue to grow and expand, is to be able to serve seniors in the home as well, and keep them healthy and well.
Got it. Thank you so much. I was going to ask, in terms of technology and leveraging it for longevity, what is your biggest hopes about digital technology and digital health going mainstream?
Yeah, I mean, it's really exciting. I think, as you mentioned, these baby boomers are turning 65 every day in the thousands, and they're much more adept to using smartphones and technology and wearables and so forth. And so that's really exciting for us, because those additional tools and comfort with technology makes it easier for us to deliver that high quality and complex care. And so again, another reason that we had decided to start with the community customer base is because we have bedside caregivers who can facilitate the telemedicine visit for the seniors as part of that infrastructure that I was speaking about. And so that allows us to provide care to, it doesn't matter if you're 90 with dementia or you're 70 in an independent living community, the bedside caregiver is going to facilitate all the technology. But as we try to move into the home setting and in other settings, having seniors that are comfortable with technology, I think will be a huge driver there.
Awesome, thank you. One of the things that our CEO, Joanne Jenkins, CEO of AARP, referenced is that age is really about growth and it's really about mindset. And one of the things that she wanted to emphasize to executives was to really think about this population as an opportunity to increase longevity, but also increase solutions in this space. When you think about age tech and solutions in this space, what kind of words of wisdom would you have for folks to think about creating more inclusive solutions?
I mean, user testing, right? I mean, I think you have to really understand who you're trying to help and build solutions specifically for that end user. At Tembo, we're really trying to build a platform, but for us to have a successful platform, I really thought it was critical for us to provide the care in our first stage of what we're trying to accomplish, because that allows us to truly understand the needs of the seniors we're trying to help. I think there's a lot of examples of big tech companies, whether it's Google, Amazon, Apple, trying to solve healthcare as an example. That they have the resources, they have the technology, and they're trying to get into healthcare. And I think time and time again, what we're seeing is they take these valiant efforts, which I'm really excited about. I hope they figure it out. But healthcare is difficult, it's complicated, and you can't just throw technology at a problem. You have to understand the problem to then develop the right solution. And so I think, especially with age tech, it's really critical to understand the baseline status and the real problems before you try to come up with a solution.
That is so key, understanding and talking to the users, and also caregivers are so important in terms of creating solutions that have their journey in mind and not what we think, but hearing from them directly. I'd love to hear what's on the roadmap for Tembo Health in the next few months, few years, and some other long-term vision.
Yeah, so right now in the immediate future, we are just focused on helping as many seniors as we can. So we are continuing to scale across the country with more and more senior community partners, which is really exciting. And so we're actually hiring for a bunch of new roles across engineering, product, operations, clinicians. If anyone has any referrals, I put a couple of links in the chat box there. We would love to continue to hire inspirational team leaders. And so that's our current focus is just scaling and helping more seniors. And then in the long term, again, we are building this platform and this database that we think we'll be able to scale even further through partnerships with other organizations, ultimately with the goal of keeping seniors healthy, happy, and at home.
Awesome. And if people want to get a hold of you, what's the best way to do so?
So we have like a message box on our website. That'd be the best ways is to connect through there or on LinkedIn as well. Those are both good mediums. My email inbox is totally blown up these days, so things get lost very quickly there.
Thank you once again. Thank you, Dr. Anurag Gupta. It's been a pleasure.
Thanks, Sheila.
Yeah,
Thank you.
yeah. Thank you very much, Sheila, for a terrific interview, and thank you for joining us today. We know how busy you are.
Yeah, glad to be here.
I enjoy being here. Thank you.
Wonderful. And really just a terrific illustration of how digital health in the ecosystem today is being utilized to help improve the accessibility of these absolutely critical resources in our ecosystem, and looking at having all 8 billion people being able to utilize these tools in the not so distant future as a mechanism of the diffusion of digital health technologies.